atopic dermatitis, eczema.
Hmm.
The reason I always talk about it is just because it has a heavy association with asthma, right? A lot of
Yes.
the kids that I see
Hmm.
and adults that I see. What is atopic dermatitis for eczema?
Yeah. So atopic dermatitis or eczema pretty much is that red, dry, itchy rash. You can get it in childhood, and unfortunately, you can, it can progress into adulthood, or it can go away and then it will come back as an adult as well. It's pretty much a problem with the skin barrier. So there's actually like a genetic mutation. So people that have eczema, their skin is not holding on to the water like our skin does. So it ends up getting very dry. It gets itchy. They scratch it. It hurts that skin barrier even more. Then it gets more dry, it gets more itchy. It just becomes a very bad cycle. And then, as we talked about it, once the skin barrier is compromised, then all the pathogens, the allergens can get in. Then it can cause more of, the inflammatory rash, and these patients can have, sensitivities to certain food, to certain, topical products, environmental allergies that they can have. They need to be, treated, because if you don't treat eczema, unfortunately, it can get a lot worse. And there's correlation exactly with asthma and other allergies as well.
So when you're treating eczema, I
Hmm.
mean, again, always investigate, make sure they don't have allergic asthma, make sure they don't have chronic rhinosinusitis,
Hmm.
nasal polyp, all that kind of stuff. When you're initially treating eczema, are you using topical steroids? Is that what you're doing most of the time? Or what's your
Yes.
range here?
So again, depends on their age,
Mhm.
the type of eczema they're having, and the severity. So if they're young and it's just like a regular mild eczema, yes, we do a little topical steroid, low potency, just to bring down the inflammation. But the key is skincare, how they take care of their skin. So then we discuss, how to moisturize, what moisturizers to use. When they shower, don't do hot shower, do kind of like lukewarm to warm. Don't stand under the water for like extended period of time. When you come out of the shower, within the first 2 to 3 minutes, when your skin is still wet, that's when you want to put the moisturizer on to lock in that moisture. As far as, the detergents, you want to go in with hypoallergenic, things that are for people with sensitive skin. What they wear, certain textures can irritate their skin. So usually like cotton is better. Wool can really, irritate people that have eczema. And then we talk about obviously diet. We talk about, skincare products that they're going to use, perfumes, even shampoo, like lotions, everything that's going to come in contact, with their skin. But if their eczema is beyond just a mild, it's if it's all over, if we've done topical steroids, it's not helping, we can do like a short course of oral prednisone, again, just to knock it down. But if it's something that's for them, it becomes chronic, then we do discuss, other medications, or a lot newer medications that's out there available for eczema now.
Yeah, when we see severe eczema on
Mhm.
people, we are going to see people that are also going to have asthma. And if you think about it like this, your cells that are constantly exposed to the environment, your skin cells, your upper airway cells, your lower airway cells, and your GI tract cells, they're all epithelial cells. They're all
Mhm.
cousins, so to speak. And so when they become inflamed as a result of an antigen that they're presented with, they're all going to lead to the production of the same type of cytokines that leads to worsening of that inflammation, right? And specifically in skin or in eczema, what we talk about is this type 2 inflammation. And so
Mhm.
yeah, we're going to use the topical therapies first, right? We do the same thing with asthma. We do the same thing with chronic rhinosinusitis. We do the Flonase. We do the Symbicort, which is inhaled corticosteroids or whatever, to calm down the inflammation here. They do a little bit of topical steroids here. But when you need systemic therapy,
Mhm.
here, say oral prednisone, that's when we got to start thinking about calming down specific cytokines. And there's a
Exactly.
molecule that we share that we use probably every day, Dupixent,
Mhm.
that we use to calm down
Exactly.
atopic dermatitis, which also treats asthma. It also treats prurigo nodularis,
Absolutely.
urticaria. It also can treat eosinophilic esophagitis. And all of these inflammatory conditions are related, right? They're all related to one another because of that type 2 inflammation.
Exactly. Dupixent has just been a game changer. I love Dupixent, especially for those patients that their eczema is just beyond like a little itchy, scaly rash. So it's a great medication to be on just to control it and other, symptoms and everything that you mentioned.